Good morning, all of you. Dr. Vasan Ranasingam, moderator for this lecture today. Let me to introduce the resource person today, Dr. S. Selvaganesh. He is currently working as a consultant plastic and reconstructive surgeon, teaching hospital in Jaffna. He is a product subsequently after becoming the graduate studies in the field of surgery. Completing the MD surgery in the year of 2014, and he chose to become a plastic surgeon or the expertise in the field. And he has experience in the foreign training, the Ganga hospitals, the one of the world largest plastic surgical hospital in Tamil Nadu and in India too. And also he has a fellowship, the hand surgery in Singapore. He trained in Singapore too. So he's a valuable resource person today. I don't want to much take the time of the lecture. So I right away invite Dr. S. Selvaganesh, consultant plastic and reconstructive surgeon, teacher hospital Jaffna, to go ahead with the lecture. Sir, it is over to you.
Thank you, Vasan, for the kind introduction. Today's topic is about negative pressure wound therapy. It may not be a new topic for you, so I will get on to the topic. Okay, negative pressure wound therapy is also called vacuum assisted closure, vacuum dressing, and negative pressure dressing. So these all are synonyms. And basically, the principle is application of atmospheric pressure in a controlled manner to the wound surface. So the nail is a Soviet Union army surgeon. He was the pioneer to initiate this negative pressure wound therapy, and then the Louis Argenta is the one who introduced it. So basically, even if you don't understand anything, if you can understand these 3 points, I think it will be great. So appropriate debridement of wound is very important, and while you will learn during this lecture the application of foam to distribute the pressure evenly to the wound surface. So during that you should not pack too tight, and don't forget the patient as a whole. You are thinking about healing factors, pain relief, and other therapy modalities and all. So you don't just concentrate on only on dressing. So these are components of back dressing, where this is the foam where it's going to be applied or touch the surface of the wound, and then this is tubing system which connects to the canister here, and then canister is given a negative pressure, suction pressure of 120 negative pressure by this machine. This machine is basically a mini computer where it can continuously give or interview, depends on our modality, what select. So I will come to those details in further slide. So this is the machine where it has several sophisticated facilities to distribute the pressure onto the wound surface evenly. So these are the drapes where we had to get this foam pasted onto the surface, and we had to get the seal. So those details will come in other slides. So there are several varieties of vacuum machine pumps in the market. So we have all these types here in our country. So these are microcontroller processed unit, and it can operate on battery or main power supply. So basically, when it is working on battery, then we can just carry it. It is easy to transport from theater to ward without power supply, based on battery power. And this is a latest version where it is called Veraflow, where irrigation is applied. So you can, if you want to irrigate the wound while vacuum dressing is on, So you can do that also. You can irrigate with antibiotics, saline, or whatever. So by back dressing itself, it keeps the wound surface moist. So even we have portable versions. So where patients even can carry and even can go home, go for work. So there are mini versions for small ulcers and all. Even we can have back dressings, the vacuum. So canisters connected to this machine has various volumes, and the companies have made them where they cannot be reused. So once the canister is filled, we have to change the canister if necessary to continue the vacuum pressing. The machine has special alarms where when the tube is get blocked, you will get an alarm, and then if the canister is full, you get alarm, and if the battery is low and leak or low pressure, then you get several various alarms. So it's very easy, and then you can sort it out the problem if there is any. And this is a foam where it is going to be applied onto the wound surface. It has several customized designs. The beauty of this foam is it distributes the pressure which is applied by the machine, and it through the tubing, and it goes to the wound surface evenly. This is made of polyurethane. There's just a customized foam for the hand wounds, and where if we want to pack a cavity, where we can the ribbon like designs. So when the wound surface is applied with foam, and then the beauty of this foam is when you apply the negative pressure, it won't get compressed. The micropores are maintained. So all the surface areas, the pressure is applied equally. If you just apply a commercially available whatever the cushion, it will just get compressed, and then the pressure will go to one place, and one place will not get the pressure. Here, all the surfaces get the equal pressure which applied by the machine. And it has micro pores where they are not compressed even at that negative pressure. So that's a secret of the pressure going evenly to all the surface. And then there are polyurethane. This polyurethane foam, the open cell reticulated, that is the micro holes which are 400 to 600 micrometer in size, which are maintained even in that negative pressure, and they are moisture repelling, so they always keep the wound surface hydrophobic, that's moist. And sometimes we have other designs like silver impregnated foams where it gives antibacterial action. So this is polyvinyl alcohol foam where you can pack the cavities. Is very pliable foams, but they are very expensive. So tubing and connectors to the ports. So tubing delivers the negative pressure from the foam to the machine to the foam, and then if there is any collections or exudates, it comes through the tubing and go into the canister. There are several type of foam designs where the ulcer is here, then the machine is connected with this, and then even the patient can wear his clothes and footwears and is comfortable. So basically, this negative pressure wound therapy the advantages are it helps to contract the wound, and it removes the exudate from the wound and increase the perfusion, and it gives a moist environment to the wound surface, and it gives a closed environment. There is no contamination to the wound surface, and sometimes when we apply on a skin graft or flap, it acts like a ball, so it's just compress and keeps the graft in place. So where we can apply this wound therapy, like in acute setting, trauma, burn, and then in subacute settings, there is wounds, and in chronic setup where diabetic wounds and venous ulcers, bed sores, even we can apply on flaps and grafts if necessary. So contraindications where if the blood vessels or organs are exposed, we don't. It's not recommended. And on the anastomotic sites and malignancy, also on malignant and suspicious areas where it is not recommended, and untreated osteomyelitis and fistulas. These are the areas where we don't recommend vacuum negative pressure wound therapy. So during application, you should have a good seal with no excessive packing of the wound, additional non-adherent layer where the if you have a small leak, the leak alarm will be working, and then sometimes you may have to have more and more stickers to get the additional seal, and we usually apply the foam with a small piece of adhesive tape first and get everything set up, and then we paste the big tapes to get the seal. Then that will come in the videos later. So sometimes we put higher pressure while starting to get the seal, and then we go to the standard recommended pressure. Then after that we sometimes put cotton and crepe over the wound. So these are just examples of wounds which have been applied vacuum dressing. Where here you see there's a wound here and there's a wound here. It has been bridged with this thing. This part is covered with tape. So this wound also given negative pressure through this bridge. So this wound also, both wounds are covered with one dressing. This is a larger bed saw and then ultimately brought up to this size with the help of the vacuum dressing. This is a necrotizing fasciitis of the hand. Then with the help of negative pressure, then grafted, and then vacuum dressing applied on graft, and then the ultimate result. Is another necrotizing fasciitis, the badly infected hand, and the index being amputated here, and then the final result. So the fracture of the leg where it's a bit dirty. So it's before putting a flap, we have just get this wound status improved with the back dressing of 1 week, and then after that we have covered the wound with muscle flap. So it's a congenital deformed leg with a pressure ulcer, and it was there for years and years, and then finally managed with back dressing and then the corrective arthrodesis of this ankle. So this again a bed sore get this good healing status by the vacuum dressing. Another patient with a lot of comorbidities on clopidogrel and all. So he was also managed to get the wound healed with vacuum dressing. There is another Ayurveda practitioner messed up the leg close fracture, was given traditional pattu, and then end up with necrotizing fasciitis, and then the lateral gland anterior compartments necrosed, and then ultimately healed with vacuum dressing, and then the latissimus dorsi muscle flap, and then finally with the skin graft, and then came to now patient walking. This is a spinal implant exposure in the posterior midline. Then it was managed with vacuum dressing, and it basically got the closure. So setting up the pressure, standard negative pressure recommended is 125. So chronic ulcers, sometimes we go for less pressure, some because they are, once you apply this negative pressure, the foam surface gives counter pressure to the wound surface also. So if the wound surface is bit poor blood supply patient, like in peripheral vascular disease candidates, we go for bit lower pressure. So you can adjust accordingly with your experience. You can go for higher or lower pressures. So there are two settings in the negative pressure therapy. There are intermittent setting where every 5 minutes there is an off period of 3 minutes. Continuous where the 125 millimeter mercury is continuously applied onto the wound surface. But there are evidences where intermittent wound therapy is better perfusion, gives better perfusion to the wounds than continuous, but intermittent has the problems where during the interval where there can be leaks. So duration, usually we recommend 22 hours a day. So you can have 2 hours of off. You can off the machine for 2 hours if you want, for any other purposes, going to for bathroom, toilet, or something. Or battery is available always, and we usually keep up to 10 days. And then, if the machine is 20 more off for more than 24 hours for due to any reason, so better to remove the thing and reapply a new one. So this paper they have used vacuum dressing before they are definitive coverage of the flaps of the bone, compound fractures, and they were able to uh, get good results. So regarding the bacterial load after vac therapy, there are animal studies. They have found after 4 days the vacuum dressing bacterial load has significantly gone down. And they have monitored C-reactive protein. So basically, after vacuum therapy applications, the inflammation level also has gone down because with this negative pressure, bacterial activity on the wound surface is very less, and then the exudates and toxins, everything will be sucked out into the canister. So when to remove? So once you decide after one cycle, maybe 7 to 10 days, I usually do adrenaline lidocaine around 10 cc with the normal saline of 10 cc, and I just clamp this tubings, and then I infiltrate into the foam and let it be there for an hour. After that, it is easy to remove. Otherwise, the foam gets pasted to the wound surface, and when we are removing, there can be oozing. So sometimes I keep bit of Vaseline goes inside and then apply the foam. And so before removal, better give adequate pain relief. So these are the names. So what are the advantages of vacuum therapy? Beyond its cost is bit high, but can keep for a week. For a week, there is no more nursing care. If it is properly applied, just it will look after the wound. And so there is no wound dressing. There is no wetting of linens or the bed, and it buys the time for us to decide on the definitive close. So if in the middle of the night compound fracture comes, then you can decide in 1 or 2 days to put the flap. So till then it keeps moisture and perfuse the wound surface. So sometimes for bed sore patient and all, they can just get the wound dressing, the back dressing applied at home, or even for the chronic ulcers. So even you can do this at home care settings. And so the faster wound healing, sometimes we apply for over the graft, where it keeps the graft in place. So this paper says they have tried. They were able to prevent infection in open fractures, but there was cases of macerations. So again, this is another paper. They have found the bone exposed patients got good results following with a declaving injury due to the back dressing. So effect on flaps. Once we do flaps like muscle flaps or skin flaps, and then we can apply a work dressing onto the flap, and then it will reduce the flap edema and it will secure the flap and keep it in place, and it will help in uh, avoiding venous congestion, and it is increase the vascularity to the wound surface, and so last sentence, I think it provides anchorage to the graft and flap, so it keeps in place, basically bolster. So disadvantages, it is costly, bit costly, and you need some training for the application. You can't just apply like other resins. You need a bit of training. So this is an evidence where they have compared the normal saline gauze and the vac dressing. So the cost is very less, and then the days of wound is 97 days. It has healed in 97 days. It is there for 247 days. So it's even the cost is bit high when you compare only the machine, but ultimately the total cost is less. So in our patient setup, patients pays 2 or 3 times while going by taxi, maybe more than our vacuum charge. So with the after application, you have to see daily what is happening to the canister collection, whether it is going less, and uh, then the wound size with the each and every cycle, then you can compare, and then you can see epithelial growth will happen, sometimes granulation tissue formation, it will be a healthy granulation tissue. So when to discontinue after application? Sometimes it is fast filling canister with blood. So if there is an evidence where if we don't, without noticing, if we put a vessel into the vacuum application area, if we leave an open vessel, and then it's a problem. Then if somebody calls you and they spill with blood in half an hour or 1 hour, then better stop it. It is not recommended for MRI or hyperbaric oxygen chambers. If the patient is on vacuum dressing, they cannot go for MRI. So again, for take-home message is appropriate debridement, wound excision, and so that is very important. Without doing an appropriate wound cleanup, don't apply the dressing. So don't tightly pack it. That will be, you understand with the video. So look after the other factors. And I will play a video, and then you will understand that.
That you remove all the foam pieces. The VAC therapy system is indicated for patients with chronic, acute, traumatic, subacute, and dehisced wounds, partial thickness burns, ulcers such as diabetic, pressure, or venous insufficiency, flaps, and grafts. This video is intended for clinicians. Prior to use of the VAC therapy system, consult detailed product instructions and important prescribing information contained in the KCI VAC therapy clinical guidelines and the device or disposables specific user's guide. Additional safety information specific to the VAC therapy system is available at the end of this video. Contact your local KCI representative or call 1-800-275-45.
This video is on YouTube, so you all can see the video. Don't worry about these are American details, so don't worry about this contact number and all.
524 if you have any questions before initiating therapy. If you are performing a dressing change, be sure to identify the number of foam pieces previously placed in the wound. Ensure that you remove all the foam pieces. VAC dressing application. Assess wound size and type. Cut dressing to appropriate size. Do not cut dressing over wound, as this could result in foam particles falling into the wound. Gently place dressing in wound without overlapping onto intact skin. Note the total number of pieces of foam used.
Cutting the vac dressing to the foam to the size of the wound is important, because if you pack too much also not good, and because for it to work properly, you have to have adequate optimum size. If you keep more on the outer surface, then there can be maceration of the skin. So you have to have correct size.
In the wound. Vac drape application. Measure 3 to 5 centimeters from border of intact skin. Trim vac drape to size.
We usually clean the outside the wound before application of this tape with the sprit or sometimes ether. Otherwise, there can be leaks.
Retain blue handling tab on portion of vac drape used. Peel back one side of layer 1. Place adhesive side down over wound. Remove the remaining side of layer 1. Remove green striped stabilization layer 2. Remove perforated blue handling tabs. SensaTrack pad application. Identify SensaTrack pad application site. Pinch drape. Cut at least a 2.5 centimeter round hole. Do not cut a slit or an X, as it could self-seal. Remove backing layers 1 and 2 from SensaTrack pad. Place SensaTrack pad opening directly over hole in drape. Apply gentle pressure to secure. Pull blue tab to remove stabilization layer. Connect SensaTrack pad tubing to canister tubing and open clamps. Count and note the number of foam pieces used in the wound and document on the supplied foam quantity labels on the vac ruler and in the patient's chart. Record the date of the dressing change. The foam quantity labels can be peeled off and placed in an area that can be seen by the next treating clinician. For example, around the SensaTrack tubing, on the vac drape, and in the patient's chart. Turn on power to the vac therapy unit and set to the physician-prescribed therapy settings to initiate therapy. Vac therapy is contraindicated for patients with malignancy in the wound, untreated osteomyelitis, non-enteric and unexplored fistulas, and necrotic tissue with eschar present. After debridement of necrotic tissue and complete removal of eschar, vac therapy may be used after hemostasis has been achieved. Vac therapy foam dressings should not be placed directly in contact with exposed blood vessels, anastomotic sites, organs, or nerves. Patients with sensitivity to silver should not use the vac granufoam silver dressing. Do not place any foam dressing into blind, unexplored tunnels. The vac white foam dressing may be used with explored tunnels. Instructions for use and safety information. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on bleeding, exposed vessels and organs, and infection, applicable to your vac therapy unit and dressing application that can be found within the therapy unit, disposables carton, or in the vac therapy clinical guidelines. www.kci1.com. These sources provide information concerning the proper application of all vac therapy dressings, including advanced applications and techniques. If you have product questions,
And there are some questions, so I will try to. Which hospital does this method are being used currently in Sri Lanka? So it is started from NHSL, Anuradhapura, LRH, Jaffna, everywhere available. But sometimes all the patients are not affordable. Is this causing pain for the patient? When this negative pressure is applied, it gives a bit of counter pressure. The foam side gives a pressure to the wound surface, so it gives a bit pressure, but this is not unbearable. We can manage it analysis. So I can't say there is no pain due to this, but it is the advantages are more than causing pain. So can you use this for small malignancies? No, contraindicated. Okay. So is this suitable for venous ulcer? Yes, venous ulcer can use it, and for wound. No, always you have to depth right and do. But if it's a minimal slough, it's okay. But if you can get the slough out and apply, it's ideal. But with a minimal layer of slough, where sometimes backpressing itself is a de-sloughing mechanism. So with the backpressing, when you remove the slough also comes out. So minimal slough removal is just possible. Any other question?
I would like to ask a few questions. One is, say, what is the average cost
So
for this
it
therapy in the sense?
It is available. Basically the machine is provided by the companies. They rent it, and so they charge only for the foam. So keeping the machine with them in their inventory, and they keep the foam. So foam is available in three sizes. So it is small, medium, and large. Before economic crisis, the large size foam was around 45,000, but now it has gone up around I think 60. So smaller one is going around 30, and then it's 45, 60. So that range is now. So sometimes some hospital directors they local purchase. So some may not be possible because it takes some time for the local purchase process. So in that case, sometimes patient gets afford it. Most of the machine may be 3-4 lakhs. I don't know exactly. There are 2 to 3 companies. CAC is one, and then the Synergy, and there are companies doing. So for this question, how many cycles of dressings needed for one patient depends on the wound factor, patient factor, and then your reconstructive facilities available. Sometimes 1 cycle, sometimes 2 cycles, sometimes even I have gone for 3 cycles. So it depends. That's with your experience and your patient factors. Everything will be like. No, you can't use the sterile sponge because that particular foam made for the purpose will maintain the micropores even with a negative pressure of 120. But when you your normal sterile sponge suction machine where it won't give the always the negative pressure of 120. When you use the suction pressure of your machine, sometimes when the machine gets blocked, it will give more. It will try to give more pressure. So, but our negative pressure, that particular machine will alarm and let us know that something going wrong. So it is automatically is mini robot in wound care. So you can't use the suction machine. I don't recommend. Any more questions?
Since the audience don't have questions, we are about to close the session for the today. And whoever the participant wish to get e-certificate, we have shared the link to the chat box so that they can click and then request for a e-certificate. So on behalf of Sri Knowledge Academy, we will thank all the participants for the today's event, and also our valuable resource person, Dr. Selva Ganesh, consultant plastic and reconstructive surgeon and teaching hospital Jaffna. And also we will be waiting more sessions from him on the field of plastic and reconstructive surgery. I know he is working tirelessly to provide better care for the surgeons, not only in the Jaffna hospital, but for the northern province. So the audience here today, we will meet next Sunday with something, say, the good session for you all. Thank you very much for your participants, and thank you for our resource person.
Hassan, give me a minute. There is a question. Pseudomonas positive, whether we can apply the dressing? Yes, you give good dressing, good clean up, treatment, and you can apply. There is no contraindication for infection. So you can't have a sterile wound. You have to have. You can apply with the infected uninfected wound. Even necrotizing fasciitis wounds and all we apply. You just cut the foam with the scissor or scalpel blade, whatever instrument you have. Okay, thank you very much, Vasan and the team and the all listeners. Thank you.
Thank you very much. Have a nice day for you all.